Hi, this is Dr. Ahmed D. Abdulwahab, and this is the answers to the quiz of the last episode of Highlights in Radiology. In the last episode, I asked you a few questions about what type of intracranial hemorrhage is that. So today we will answer them very quickly. This was the first question, and if you look carefully, you can see an intraparenchymal hematoma here in the right frontal lobe. And again, you can see presence of blood going into the cell side of the brain, confirming there is a subarachnoid hemorrhage. And you can see this some mild mass effect here if you compare it with the other side. And this was typically an intraparenchymal hematoma with subarachnoid hemorrhage. So it's a mixture. Again, if you look carefully, there is an intraventricular bleeding with the blood in the occipital horn of the lateral ventricle. So here we have an intraparenchymal, subarachnoid, and intraventricular hemorrhage. The second question, this is a typical extradural or epidural hematoma. It's lens-shaped, biconvex, and it's dense, so it's an acute stage. What we need to do here is to do a bone window to look for an underlying fracture. The third question, what do you think this is? Well, it's a big bilateral epidural hematoma. You can see it's biconvex here and biconvex here, and it's limited by the suture, okay? And it's dense, compressing the underlying brain. So this is a bilateral epidural hematoma, and we should do a bone window to look for fractures because most likely there is an associated trauma. Now, let's see this one. Do we have anything here? First, we have a big mass effect compressing this lateral ventricle. We cannot see it. Some midline shift. So why is that? Because if you look carefully, there is a large hematoma here. And what kind of hematoma is that? This is a subdural hematoma. But why? Because if you look, it's not limited by the suture. It's crossing the suture. It's not crossing the falx or the dural reflections. And it's following the surface of the brain, and it's crescentic in shape. Typical subdural hematoma. And it's isodense. It's either hyperacute or the patient is anemic. What do we have here? We have a huge, large intraparenchymal hematoma, and it's extending into the ventricular system, causing intraventricular hematoma, filling the occipital horn of the lateral ventricle, and of course it's causing large mass effect, displacing the brain to the other side. It's causing herniation. So this is a large intraparenchymal hematoma with intraventricular extension. So this was it. Thank you very much. See you on Friday. Don't forget to subscribe. Bye-bye.